Ms. DeGette for her 5 minutes of questioning.
Thank you so much, Mr. Chairman. So about 1 in 6 adults use AI chatbots at least once a month to find health information and advice. And even more people under 30 use AI chatbots for health information. But of course, as all of you know, and even we know this, AI chatbots are not doctors or nurses, and frankly, we're not regulating them as medical devices. No chatbot, whether it's purpose-built for mental health or a general information chatbot like ChatGPT that uses generative AI, has been approved by the FDA for that purpose at all. And so, Dr. Torous, I wanted to ask you, you note in your testimony a lack of research into the efficacy of generative AI tools for mental health. What important research questions do you think need to be answered about whether generative AI tools can provide clinical benefits?
Thank you for the question. I think we've all seen studies in the media that these chatbots can be a therapist, and we know when doing behavioral health research in psychiatry or psychology, there's always a placebo effect, there's a role of expectations. That's not a bad thing, we have to acknowledge it. So when companies come out and put these studies, or researchers come out and do not put a single control group and say one group talks to ChatGPT about the weather and one group gets therapy, we're really not giving ourselves a scientific basis to understand the question. What we also need to do is replicable research. We know that you can always get an interesting finding once when we do science. The whole point of chatbots is they're scalable. We can engage millions of people. So it's a very simple ask for us to say we would like research that has digital control groups, and we would like research that's replicable. That is not asking for anything radical. That is basic science that we could go to a middle school class and they would say that is what we want. And we should hold everyone accountable to at least middle school science.
Even Congress.
Yes.
Just a couple of weeks ago, the FDA Digital Health Advisory Committee had a meeting on generative AI and mental health. The advisory committee noted the importance of transparency and explainability, as well as rigorous ongoing performance monitoring, which is what you're referring to. What challenges does the FDA face in promoting safety in this way? And are there improvements in the FDA's authorities that we could look at that would be useful to drive innovation while ensuring patient safety?
I was a member of that advisory committee on it, and I think the FDA has a really big challenge in front of it. We have these chatbots offering or purporting to offer therapy. They're currently being regulated not as a medication, but as a medical device. And in a medical device, there's different risk levels of medical device. A class 1 medical device would be a Band-Aid. Class 2 would be kind of a contact lens. A lot of these chatbots are going through as a class 2 medical device, say like a contact lens. Again, in a lot of the evaluation there is different. What we kind of thought about to make medical device regulation for pacemakers or contact lenses is completely different than a conversational, interactive tool that works with you. So I think what we really have to do is think about a new type of regulation. And several years ago, the FDA proposed a pre-certification model. It was sunsetted, I think, in 2021, but it was a more life cycle approach to regulation. And I think the reason that the FDA had to sunset the pre-cert model was they did not have the authority from Congress to regulate in a new way. So I think that you actually have the key power to let the FDA do the job they want to do, but they are going to need new power from you because else they're going to be trying to spit AI into a contact lens.
Well, exactly right. And we're going to need help from folks like you to help us figure out what that looks like. Very briefly, Dr. King, I want to talk about patient privacy safeguards. ChatGPT and other general information chatbots don't have to comply with HIPAA. Is that correct?
That's correct.
And what dangers are there in disclosing sensitive health information to a general information chatbot?
So two, I would say offhand. The first is that the company that collects that data may repurpose it for other uses, including targeted advertising, for example. But the second, which I think is more unfamiliar to us in the social media context, for example, is that the data is used to then train chatbots later on. And so from the study I did recently, we really don't understand right now to what extent the companies are potentially cleaning that data before it is used for retraining. And there is research demonstrating, including research by employees of the large companies, that chatbots can memorize training data.
Thank you, Mr. Chairman. I yield back. That was very helpful.
The gentlelady yields.